Hello, I'm Dr. Stephen Crawford. I'm chair of the Oklahoma Alliance for Healthy Families, and I'm also co-chair of the Oklahoma Academy of Family Physicians Legislative Committee. And I want to talk today about the importance of healthcare access for everyone. I believe that there are three principal reasons that everyone needs to have access to quality healthcare. The first issue, I believe, has to do with that it's a human right. We don't allow people to sit on the side of the road with broken bones and heal on their own. We believe it's a human right to be able to go get health care. But more importantly, we need to try to prevent accidents or health issues from occurring. So we need to intervene early. And to be able to do that, we have to give people access to the preventive care, early onset or early access to care when when diseases and conditions are preventable, whether it be things like diabetes, obesity, hypertension, stroke, but also many of the things that children are exposed to, particularly uh, vaccine preventable diseases that give us a fighting chance to make a difference in our lives. I also want to speak on the issue of economics. I think it's critical that we as a state and a nation have a healthy citizenry. If our citizens aren't healthy, we won't have a healthy economy. We won't attract business. We won't be able to withstand the challenges that many of the countries that we compete against who do have robust healthcare systems can defend themselves and prevent diseases from ravaging their communities. And so I also think it's a national security issue that all peoples that we have within our borders are protected by access to health care and preventable and treatable diseases. The last thing that I think is important is that it helps prevent diseases from affecting others. As we've seen during the pandemic, when somebody gets infected, it can affect other people because there's a period of time when people become infected that they are contagious but not symptomatic yet, the asymptomatic carrier, as it's called. And if we don't give those people access to getting testing and such, we then create diseases that occur to other people that may have access to health care, and it impacts them and costs them illness and challenges to deal with. So we need to be able to provide access to health care to all individuals that are within our purview, as it were. And if we're talking about Oklahoma, we need to get everyone covered in Oklahoma and take care of those people that were within our borders. But I believe it's true that we need to be doing it for our nation and actually for our world. Uh, there's obviously the debate on who should get the vaccine, and we should start with those that are at highest risk and those that are exposed because they're providing care to those individuals. But I believe we need to be advocating for a worldwide program to provide access to vaccines to prevent this pandemic from spreading not only to them, but also back to us. Because if we don't do that, we will have, unfortunately, the development of what we've seen occurring is the more contagious variants of this COVID virus that can overpower or bypass the vaccine that's currently occurring. So again, the three things that I think are important is that it's a human right that everyone have access to quality health care. The second issue is the economic and security, national security issue that I think are critical, that we need to have a robust and healthy population to be as strong a nation as we can. And the third issue is that it helps prevent the spread of disease and contagion, as it were, to many others that could be affected by illness. And so we need to protect ourselves by protecting others and providing them health care access to. Coverage is currently provided through a variety of means, one of which is Medicaid, that we've had in our state for many years. One of our former legislators back in the 60s was one of the strong advocates for doing a Medicaid program or a Medicaid light program for our state and for the entire nation. And a recent legislator was very supportive of moving us to a more managed care type of Medicaid program in the early 90s, which we did. And we experimented with a managed care type program. But unfortunately, that program did not work well. And our Medicaid agency transitioned to a more robust single payer type of program that we believe as practitioners within our state has worked very well and very effectively and very economically. Obviously, there are some challenges that they can probably address a little bit better, but I believe across the nation, our Medicaid agency is looked at as a beacon of excellence in how to manage Medicaid in our state. And notice I'm saying manage Medicaid because our agency does manage Medicaid throughout the state using a primary care patient-centered medical home. What we're looking to transfer to is a commercially managed Medicaid program with 4 different providers. And some say, well, that will provide competition. I believe that it could provide some competition, and they'll work at trying to attract patients to their plan or this plan. The problem with that is that it increases the hassle factor for patients. It increases the hassle factor for providers. It also increases the costs of care substantially by 2 or 3 times the cost that we're already expending. You have to expend some money in administering a program, but we're currently at an exceedingly low rate of 4 to 5% per year of the amount of money that are expended to manage this group of patients. If we go to a commercially managed care, these companies rightfully will have to make some money to be able to take the risk to do this, but they need to make anywhere between 2 to 3 times the amount of administrative costs to make it worthwhile for them to compete in this type of market. And I don't believe as a clinician, nor do I believe as a provider or a person that's been involved in Medicaid and an advocate for the patient-centered medical home, that this is a appropriate or valid way to manage our Medicaid system in our state.